The real issue is not we need to merge. The real issue is that neither social care nor healthcare have been adequately funded. Local government has had its budgets actually cut. Social services are responsible for adult social care. The only wriggle room they've got is eligibility criteria. There are 4 levels of that. Most local authorities now are at the absolute extreme of eligibility criteria. So what that means is you really do have to need help before you get it, because they haven't got any money. So what that means is there are about 900,000 people now who used to get social care who no longer get it. We've got 900,000 refugees in our system. Is it any wonder a shed load of them turn up at A&E? Of course they do. And so merging the two organisations just merges the problem. The real problem is funding and workforce. And I think it's perfectly possible for two local organisations to work together. If you merge them, here's the problem. Local government works on an eligibility criteria, it works on a funding criteria, the NHS doesn't. The NHS is free at the point of need. Social care isn't. It's worked out on a means tested basis, really. And it's merging the philosophies that is the problem. Will all social care become free, or will NHS become means tested? And that's the problem of the two organisations. My own view is that social care should be free at the point of use. And I think we should pay that through taxation. I mean, if you look at the NHS, we all put a few quid in the tin because one day we might get run over by a bus. And if we do, the money's in the tin. If not, the money's in the tin for somebody else. We're all going to get old. We put a few quid in the tin. Some of us will get old, have healthy lives and die on a golf course. Other people will become frail, they'll need help, have dementia, they'll need a lot more help. The money's in the tin. The answer is taxation, socialised care. You know, it's all this business about means testing and selling a house and blah, blah. It's a nonsense. We know what we need to do. I think merging myself, I think it's a diversion. I wouldn't bother with it. It's going to be a huge upheaval. We know what to do. Fund it properly.